Okay, so I'm Ashley. Um, talk about the prevention approaches, the preventative that have been developed and tested for the LGBTQIA population, just specifically in reference to the substance use. And there's not actually a whole lot that I have found that has already been developed. A lot of my points are probably going to hit on Catherine's points as well. We're going to briefly touch on the key components. I'll go over some of those, just things to keep in mind that when we do make these programs in the future, that things that need to be included for that. It's important to note some of these approaches do in fact exist and are thriving. There is a huge lack of services provided for this specific population in regard to the preventative measures. Now, when I say preventative, I'm talking like, the things that are put in place to be proactive against something, not once it's already started. And that's where I was having issues. I was not able to find any type of program or threshold that was aimed at the prevention specifically. But what I did find was with a particular specific population, as we know, different populations often benefit from tailored strategies to help deter substance abuse issues. With the subpopulation of LGBTQIA, we must look at the unique vulnerabilities faced within the community to truly get a grasp on the types of approaches that work the best. We know that peer support and mentorship works really great for this group. It's highly beneficial within this community, and it's effective, and it offers a safe and understanding atmosphere. However, generally these practices are after the effect of use and they're not prior to, which is where I was having issues. They're intended more like preventing relapse instead of preventing use. Members of this population can experience guidance and wisdom for their struggles of people who live similar lives and similar experiences. I found a really neat program called GLAST. Gay and lesbians achieving sobriety together. It's a magnificent, it's just simply peer support. That's all it is. In a resource hub. And it is located in Cincinnati, and it serves the greater Cincinnati area in northern Kentucky. GLAST offers services tailored to the population, and it aims to serve as a support system to break the cycle of addiction by pairing each person with a, and they do 24 by 24. So they put each person that comes into their system, they put within 24 hours, they assign them to one person, and they're with that person for the next 24 solid hours. Another good preventative approach is gender affirming healthcare, like Catherine spoke about. Those services make sure that healthcare for this population's needs are accessed. They're generally aimed at the sensitive needs of the LGBTQIA population. And if we use those and we're able to create safe spaces for these individuals to address things such as the minority stress, like you mentioned, that is just a result of stigma and discrimination and prejudice that they are facing due to their sexual orientation or gender identity. By doing that, we can lower the rate of substance use, but again, it's not much in the way of preventative measures. Therapy would also be rolled into these services, and ideally that is where probably the most prevention, I think, can be put in. There's not really a therapeutic approach already in development, but I think if we were going to try to make one of those, I think it would be really good to start there. We would need to ideally put them with a therapist that specializes in this population for the best results, I think. There's a program called the PRIDE study. I don't know if you all have heard of that. It's a study for the LGBTQIA affirming healthcare services, and it has spent years collecting data for this population, and it also provides substance use and mental health issues for these individuals, including substance abuse. Additionally, they're a unique provider for this population, taking care of just as many of those services as they can under one roof. Through this study, they create a safe and inclusive area with no judgment, and in doing so, they create sobriety and optimal health through prevention as well as intervention. This program does it all from testing to treatment, and they support individuals in this community to improve their overall well-being. There is another, I did talk about earlier. Ideally, I would like to think that social media awareness was more active in the preventive, like a social media campaign. Such thing doesn't really exist. Today we're run by online apps and communications through our phones most of the time, so I think that would be a really good place to put that. However, research shows this to be less beneficial with this specific population. When coupled with addiction or substance abuse and recovery on top of the stigma of their sexual orientation, it kind of just rolls into a ball of effect on social media, and it has a more negative appeal for that group. There are groups on social media platforms, but they're, for lack of a better word, under lock and key. They're very specific. They're in groups that are locked down. You have to have specific guidelines and rules to get in it. And a lot of people just stir away from those. Likewise, with so many sensitive topics and areas, sometimes a public eye across a keyboard application is more dangerous than it is helpful. A study by the Human Rights Campaign found that it can be more damaging as it tends to lead to greater risks of abuse, bullying, and it actually shows increased suicidal ideations. Whichever preventative measure is applied or future ones that we are created, it's important to keep in mind the key components. Like I said, we were going to talk about those. This should include communication strategies that are tailored to resonate with the experiences as well as the concerns of the LGBTQIA individuals. We need to ensure that providers of such services are trained adequately and are culturally competent to navigate and increase awareness for this group. I also think that we need to collaborate and build partnerships with organizations and community agencies. We need to share all preventative measures that we have to this group and not kind of gatekeep anything. We also need to head research and conduct research to make sure that preventative programs are working and ensure that if there's ever a need for improvement, that we have the data to do so. By utilizing the already existing or underdeveloped prevention approaches for this community, we're making it essential to address their substance use and promoting health while we continue to strive for the empowerment of these individuals to lead healthier, happier lives. Ideally, I would like to see more programs geared towards substance use on the front lines before these individuals become sucked into the deals of addiction. I think proactive campaigns would be very beneficial. Social media, I know that the research says otherwise, but I really do think it would be beneficial if done the right way. Statistics show that 3/4 of 12th graders who identify as members of the LGBTQIA population have already tried alcohol, nearly half have already used marijuana, and 21% have already experimented with prescription medication. So this is an issue I think we need to be in front of, not in the middle of or behind it. That's my part of the presentation, and I didn't have, like I said, I'm sorry, I didn't have very much as far as preventative measures, but there's really not a whole lot out there that I was able to find. And I'm going to pass it to Cassie.